Hi, my name is Monica, and I'm here to talk to you about red wine. I recently went home to visit my family for the first time in 3 years in Vermont, and I always stop at my grandparents' house first because, they're getting older. And they were both drinking red wine. This wouldn't be something that was kind of out of place, but I have never known them to ever drink any sort of alcohol. So it was a little bit confusing. This is something that's, I decided to ask them some questions, and since they're in their late 80s, the only answers that they could give me was that the doctor prescribed it, it might reduce another heart attack by 50%, and they were just following doctor's orders. Now that I know that congenital heart failure runs in my family, yay, I was curious, since the wine industry is eventually where I want to be, and the industry that I want to be in, and I needed to know more. It is my proposition that red wine consumption can be beneficial to your heart in many ways, or beneficial to your health. I will be discussing that red wine is good for your heart, drinking it can help you live longer, and that it cuts the risk of or even prevents cancer. Although Chief Medical Examiner Dame Sally Daves quotes from a different source with newer findings, saying that her report will send a clear signal that the dangers of drinking are far more previously than thought. This includes trouble with kidneys and in some cases causes cancer versus not. There's also been studies like the one in the National Institute for Health Clinics that tells us how the middle-aged people could benefit more from exercise and healthy diet because they claim there's no safe level of alcohol consumption. I am here to tell you otherwise. The first and primary reason for my research is that drinking a small amount of red wine a day can prevent the risk of heart attacks, lower the risk of heart disease, and can help prevent strokes. Cardiologist Dr. William McRae in a Great Western Hospital in the UK did a study of 10,000 patients that were prescribed 2 glasses of red wine a day for 10 years. And he claims that it prevents clots from developing inside the arteries, raises good cholesterol, which is called HDL, and causes dilatation of the arteries. He also states that since the red wine is full of flavonoids, which is a form of antioxidant, that one of the antioxidants is a resveratrol, which they claim mops up the chemicals responsible for causing blood clots, which is the primary cause of heart disease. And his conclusion of the experiment is that 2 glasses of red wine can reduce the second heart attack by 50% and stroke by 20%. There was also a 16-year study at Harvard School of Public Health claims that if someone suffers from high blood pressure, they're less likely to have a heart attack by 30%. And according to the American Heart Association, with 51 different studies, discovered that the risk of coronary disease decreased by 20% with 0 to 2 glasses per day. They found that the tannins found in red wine called help protect against heart disease. When red wine are made in the traditional way, they contain higher levels of prostaglandins and help keep the blood vessels healthy. Not only is it beneficial for reducing heart disease, but also has other effects as well. Brings me to my second topic, longevity and anti-aging properties. There was a study in Finland over a 29 period that was published in 2007 that stated the wine drinkers have a 34% lower mortality rate than drinkers of beers or other spirits. There's also a study from Harvard Medical School that gave more details about the anti-aging properties, saying that resveratrol comes from the skins of the red grapes and is the primary reason. The research they did then became compelling proof that there was a link between the SIRT1 gene and the anti-aging properties. The French paradox is an example of this, since the French as a culture consume more fatty foods and smoke heavier than most Western cultures, but have less coronary disease and live longer lifespans. Dr. McRae also stated that in France, people consume twice the amount of fat we do, and they smoke more and don't do any more exercise, but their deaths from heart attacks are half of ours. It is also a theory for over 1,000 years that the monks usually live longer due to the moderate consumption of red wine. Working in a bar for a while gave me a lot of information on how wine is made, and I found out that the red wine is the color that it is because they leave the skin on the grapes. The skin is where the resveratrol resides. Red wine contains the necessary antioxidants, unlike the white wine, because they have the skins of the grapes. And a team from Kaiser Permanente wrote in a journal, Dr. Chun Chow, PhD, said an antioxidant component in red wine may be protective of lung cancer, particularly among smokers. There's also studies on colon cancer and breast cancer. And when talking about breast cancer, it is a tricky subject because the consumption of alcohol can generally cause cancer, but red wine can actually reduce it. In conclusion, there are many factors on why red wine can be beneficial to your heart, and a few that go against all the years of studies, which is enticing newer studies, but I feel after my research, a moderate consumption of red wine a day could be a positive effect on your body, and it could be beneficial for your health, heart, longer lifespans, decreasing cancer. Do take in consideration that all my findings are on moderate consumption, meaning 1 to 2 glasses per day, because 3 or 4 does have the opposite effect in a very negative way.
Try the bottom, try to reverse all down. Get a head start.
I think that's how it works.
All right, your personal experience, I think, is a good attention device, and then you identify your proposition pretty clearly. The secondary points are outlined pretty well. I do think that they need to be phrased a little bit more as claims, and in the body of the speech, that's especially true, because once you get to the body of the speech where you're presenting the argument, they just become signposts for the topic. You're not really telling us what inference you're making. You're just, it's, like on that last one, I could even, I just know that the cancer issue came up. I didn't even hear a claim being made about the ability of red wine to moderate the degree of cancer or influence it at all. So I think that that's a little bit problematic. We talked about this when you came to talk to me the other day about putting in some information about the conflict, to show that there's conflict, and you have that quote at the beginning that you have. That needs to go before you get to your proposition. You've got it after your proposition, after the preview, before you're getting to the body of the speech,
Okay.
And it's a little bit confusing because I'm going, well, you already set up the argument, you're starting to make your argument, and then you present evidence that contradicts your argument. I think you need to say, present the contradictory evidence first, and then say, and now to answer that argument, here's what my proposition is. It will be a lot clearer. Because otherwise, as you're listening to that information, I'm going, wait a second, I thought you just said that this is good stuff, and now you're telling me, all these negative things that are going along with it. There's a reason that it's there. I know that we talked about it. It's just placement, I think, that will help make it clearer. You cite a lot of information. I thought you had some good statistical information on the decline in risks for all of the diseases that you're talking about, so that's pretty solid. Expert testimony, you usually have the authorities and the studies being cited pretty clearly, so I think you're doing a good job there. On the French paradox, you're presenting some information there. I didn't get a source citation on that. I mean, I've heard of that. I know that you've got the information someplace, so you need to be consistent in the citations that are being presented there. You have some delivery issues that I think you're probably aware of. Pronunciation is a couple of the issues.
I haven't stood up in front of a class in 12 years.
Well, it's okay. It's just, some of it's anxiety, but some of it is just practice. Like, you're having problems with some of the terms, the pronunciations. I got one phrase that I wrote down, pro-Canadians. I'm going, wait, pro-Canadians? That means that they are, hockey players that get paid for playing. I know that you've got a phrase there, it just doesn't sound that way. It's a different word. And then there's another word that you had struggled with. That's one of those things that you just have to practice, those sorts of things. It's obvious that there's a lot of reading going on. You're not really talking to us, and that's one of the reasons why it's better to have an outline rather than a script, because you want to read the script. But if you haven't practiced the script enough, then it sounds like you were just, I've got an essay and I'm going to read the essay out loud, and that's not really what we're looking for here. And that kind of undermines your credibility. I think you've got some good credibility. I worked in a bar. I am interested in working in the wine industry. I've got family that's done these kinds of things. This is why I'm talking about that. So that builds your credibility. And then you struggle with some of those terms, that undermines it, and you're not looking at us, and you sound like you're unfamiliar with the topic. That undermines the credibility too. So you're kind of defeating yourself, even though you've set some things up to make your presentation work a little better. That's the one thing that I had that was kind of a negative. All right, everything else I think is generally good. The sources are, for the most part, cited. You've got good evidence. The structure, I think you want to phrase those as claims more, rather than just signposts, in the body of the speech especially.
I think I skipped it.
You think you skipped a section?
I think
it could be.
I think I skipped the part where it says the second topic.
Yeah.
Like, because
Oh, yeah.
I was checking the time. And
Yeah. Well, you look up at those. I know you skipped the third
Yeah.
one. I knew you
Yeah.
on the third one. You were
On
talking
the
about
third one,
cancer,
yeah.
and I said, "Well, wait a second. I know that we're here." Okay. Thank you.